Hey everybody. I wanted to share with you a small part of one of the lectures that we did for our Brain Rehab Basics course. And this was regarding brainstem rehab. So let me get, let's go to slideshow. Okay. So I just wanted to share with you the Brainstem Basics portion from the Brain Rehab Basics course that we put together. And this is the second half of the course that I taught a couple months ago, just regarding different ways to stimulate different areas of the brainstem. So the full course that I did on this is a lot longer. So if you're interested in that, that's available on our website. And with the Brain Rehab Basics course, the goal with the whole course was to create a very foundational learning for understanding some of the principles of functional neurology and this type of rehab to do in the clinic. So it started out with 4 full hours of cellular health basics. Then I went into lobes of the brain, which I've done a short intro on that a couple weeks ago. And then we went into brainstem basics, and then I did 4 hours on balance basics. And then this month I'm doing peripheral nerve basics. It's a little bit more dry, but it's still really good information for anyone that's interested in learning more. If you're a practitioner or if you're taking care of someone at home, it could help you out. So you've seen an image like this before. As a general rule, when you're doing rehab and you're doing stimulation, with the brainstem, a lot of the stimulation that I talk about is going to be mostly on the face, because the cranial nerves, how they come out and what they innervate and what they talk to, there's a lot in the muscles of the face, the eyes, and then also the sensation surrounding the face. So as a general rule, when we do some sort of stimulation to the face, it's going to affect that same side brainstem, and then it's going to go over to the opposite side brain. So you're getting information, again, that crosses over just in different areas of the body. So today we'll work a little bit on Will Ferrell and some other celebrities. So simple brainstem stimulation. The easiest way to think about this is breaking the brainstem up into its 3 regions. So you have the mesencephalon, or the midbrain, and then you have the pons, and then you have the medulla. And some of this is theoretical, some of it is evidence-based. So with midbrain stimulation, you're really looking at just a couple of cranial nerves, and you're really going to look at extraocular eye movements because of what innervates those eye movements and then where those are located in the brainstem. So you could also use some sounds too, but I'll just show you some quick examples on different eye movements you can do for midbrain stimulation. For the pons, you're going to focus more on the cranial nerves that are associated with sensation of the face, and then the muscles of movement of the face. So you're going to be working with trigeminal system and the facial nerve, and there's some good literature to back that one up. And then, of course, in the lower part of the brainstem down here in the medulla, a lot of the focus is on vagus nerve stimulation, just because what the research is now showing, and I've talked about this before, is that transcutaneous vagus nerve stimulation is a very easy, non-invasive way to provide positive stimulation to the brain and to the nervous system. So I'll show you some examples of that as well. So the midbrain. In the long lecture, I talk about, hey, what are some of the functions of the midbrain, and then also, what you may see with midbrain dysfunction, and then, other different types of rehab that we could provide. So again, this is kind of just a very brief summary, so I don't want you to think that this is all inclusive, but one of the things that I use that's very simple that you could do at home is by activating those muscles of eye movements. There's different exercises, there's tons. And one that I like is just have people tracing different shapes and letters on a wall in front of them by using a laser. And so what they do is with their hand, they draw a shape or a number, and they try to follow the point of the laser all around. And again, that's a very general exercise. You're stimulating lots of different areas, but that's more of the upper part of the brainstem called the mesencephalon or midbrain. A simple one to do though, if you don't have a sweet laser, and with this, if you don't have a laser, you can just do basically imaginary drawing. So, hey, I want you in your head to trace an A or a B on the wall in front of you, and they can do that if you don't have a laser, because most of everybody has eyeballs. So pencil push-ups, this is an easy one to do. And again, very general. People that are in the neurooptometry rehabilitation world may say, hey, you really got to get specific with this. That's very true. But as a general rule, you can get some good eye muscle stimulation by doing what are called pencil push-ups. If you don't have a pencil, use a pen, use your thumb. They're just, easy thing to remember is pencil push-ups. Anyways, you hold it at arm's length, you look at the pencil and you try to keep a single image on it, and then you slowly move it closer to you. And what you'll see is a divergence in your vision. You'll see double vision once it gets too close to you, and then you pull it back out and you are able to centralize your vision back on that. And basically what you want to do is, just to keep it simple, is you just want to work on bringing your eyes in and out. And we call them push-ups because it's almost like your eyes are doing a little push-up, if that makes sense. And general rule, you can repeat it a couple times a day. So again, at about arm's length distance, the eyes should appear to look essentially straight or slightly diverged. So the way they sit in our orbits is they sit a little bit diverged, but if you're out, they should be a little bit straight. And then when you come in, you should see cross eyes, right? You may also see, if you're working on patients, you may see eye muscle weakness. So they may have what's called like an esophoria or an exophoria, things like that. So if they can do this well, then you should see good, strong push-ups. If there's some sort of deficiency, then it may be a good idea to have their vision checked or have their eye movements assessed by someone who has the proper testing for that. But yeah, make yourself cross-eyed. Good little exercise. So again, the lecture goes into way more detail on that, but those are two little simple exercises that you can do to help stimulate that top part of your brain. This is a great exercise too, just thinking about this pencil push-ups. It's a great little exercise to do. If there is vision issues, obviously you have to go get that assessed by the proper doctor, but eye muscle weaknesses can cause vision issues. So exercising those muscles of your eyes, just like you would your arms, your legs, is really important for visual health. Okay, so the pons. I call this the belly of the brainstem. So here's an example of when we would want to stimulate the pons. What the research shows is you can increase cerebral blood flow by doing stimulation to different areas of the pons, which is the middle part of the brainstem. You can reduce pain. You can alter gastrointestinal function. You can decrease stress, decrease depression, increase focus and concentration, and stimulate facial weakness. I know some of these are bold claims, but this is based on the research, which I don't have all the research articles in here, but they're in the full course. So what else could you do? You could start with some eye movements too. Specific eye movements actually are generated by that middle part of the brainstem called the pons. One specific eye movement in particular is what's called a horizontal eye movement. And those can be done by doing different eye exercises. There's a great app that's built by two functional neurologists named Focus Builder. That's a for-purchase app, but it's really great for what you get. And there's other free eye movement apps that you can download as well. But this is what's called an optokinetic tape. So it's almost like watching trains go by. And what happens is you get some stimulation in your horizontal eye movements. You get a slow movement and then a fast movement, slow movement, fast movement. And that'll actually stimulate that area of the brainstem. And then when you're doing this, it's also a specific exercise for specific sides of the brain. So if you're drawing the tape one way, or if you're watching the little stripes go by in one direction, it's going to stimulate one side of the brain more than the other, which is pretty cool. And there's pathways to prove it. But doing some horizontal eye movements, that can actually stimulate the pons. Trigeminal nerve stimulation. So this is your fifth cranial nerve, and it's a big one. You have a big nucleus called your chief sensory nucleus in your brainstem, and your trigeminal nerve is actually, there's three different distribution areas for sensation to the face. You have what's called V1, V2, and then you have V3. They're also called ophthalmic, maxillary, and mandibular, just for the areas that they innervate. But you can actually use those sensory areas to try to stimulate the trigeminal nerve, the trigeminal nucleus, and the pons. And there's some research that shows that by doing this type of stimulation, in this paper, it discussed the effects of external transcutaneous, TENS unit stimulation to the trigeminal nerve. It actually had an effect on post-traumatic stress disorder and depression. So what they did in this paper, and I know it looks kind of funky, if you're in the rehab world, using a TENS unit for pain and inflammation on a muscle is different than using it to focus on cranial nerves, but it can have a profound effect on the brain if you have the right frequencies and all that stuff. So what they did in this one is they used the ophthalmic branch, which they drew out here. That kind of looks like a drawing that I would do, coming out of different areas. So there's different branches of the different branches, and they're using electrical stimulation here to stimulate V1 of trigeminal nerve. And what this discusses is that it does have some sort of impact that's positive on the brain, and it can actually activate the front part of the brain, the neocortex, the frontal lobes, and downregulate stress, downregulate depressive type symptoms. And again, this is just one paper, not to say, hey, if you have depression, this is going to fix everything, because, in my opinion, these conditions are very multifaceted in nature and they need to be addressed with different pieces to the puzzle. And this is just one of those pieces. So if you couldn't see it in your head, here it is on Will's head. And this is just, this is kind of silly, but basically, the way I read that was that you could use electrical stimulation to, let's say, this area to try to stimulate that area of the brain. Some of the other papers that I don't have in there that I did mention is one of the papers shows that trigeminal nerve stimulation will increase cerebral blood flow. Obviously, blood flow to brain is really important because the more blood, the healthy, good blood that we have in there can oxygenate the tissue, remove waste, and help produce neurogenesis and plasticity because they've got good nutrition, hopefully. But also this can be effective for pain, right? So things like TENS units are used for muscular pain. This paper, it was a review of some of the literature that discussed trigeminal neuralgia and the effectiveness of using low laser therapy for trigeminal neuralgia. And it showed that laser causes pain relief without any side effects. According to them, it could be helpful, especially in patients suffering from neuralgia tolerated to drug therapy. Because as you know, if you take certain medications, you develop a tolerance to them. But trying to make changes, physical changes to the systems that are causing the pain may just be a better avenue into the brain. So yeah, how does laser work? It's pretty cool. We've had a couple chats on here with one of my good friends, Dr. Brandon Crawford, who knows way more about lasers than me. But basically, if you shine them on different areas of the body and the brain, you can get way better cellular function. The way I discuss it with patients is basically cells have little solar panels on them, and light can activate the cells to produce ATP, which can help produce energy and activate the mitochondria. It can reduce inflammation. So it's pretty cool stuff. And I think laser therapy is one of the, why not, right? It's very, very, very low side effect profile, and it's very non-invasive. But if it makes patients feel better and it helps physically, then why not use it? So you can use it to shine on different areas of the brain and body. There are specific lasers that you cannot use on the brain, different classes of lasers, but there are some that you can use. And so you just have to make sure that before you do any of that, you discuss that with your medical provider, obviously. Don't just go shining lasers everywhere. So Will was getting laser therapy. And again, this is V1 distribution. This is V2 on his left. Depending on patient's symptoms and their exams, that would determine where you're going to shine it. And last but not least, the medulla oblongata. So vagus is what I really discussed here, but there's other things that you can do and other cranial nerves that you can activate. But because the vagus seems to kind of have its tentacles in everywhere, kind of below the shoulders, and it really makes sense to use that as a therapy tool. So the majority of therapy was vagus. There are some really simple ways to stimulate the vagus nerve, and some of the simplest ways to stimulate the vagus nerve include deep belly breathing exercises, meditation and mindfulness practices, but there's also some cool ways that you can do it clinically as well. And you don't have to have too many fancy tools to do that. So kind of similar to the PONS, you get increased cerebral blood flow when you stimulate the medulla. It can help increase tight junction integrity. And I've talked about that before. There's research that shows that pre-traumatic brain injury, if there's good vagal tone and vagus stimulation, it reduces the breakdown of the gut lining, which is really important because leaky gut can lead to a whole host of systemic issues. So it increases tight junction integrity. It can decrease the stress response. It can modulate and decrease inflammation that's bad, unnecessary, or ongoing. It can modulate brain function, but it can also increase blood-brain barrier integrity. So just like increasing integrity of the gut lining, it can actually increase integrity of the blood-brain barrier, which I talked a little bit about in our barriers class. So this is a really cool paper because, I'm always looking for the most non-invasive ways and non-noxious ways to try to tap into these cranial nerves clinically. Because sometimes, like for vagus nerve, they do make little ear clips that you can use in different areas to access those superficial branches of the vagus nerve on the ear. But I found sometimes patients really don't like that. So you're getting like a good stimulation, but it feels like crap. So that doesn't make sense to me. So this paper, they discussed the use of a vibrotactile device. And I've talked about this before on our page, but it's basically like a vibration pen at a specific frequency. And they did it on a specific area of the ear. This is on the cymboconcha. And the reason that they used that specific area, I don't think this paper discussed a lot about acupuncture points. But there's an important acupuncture point. There's several important acupuncture points in the ear, but there's also the auriculotemporal branch of the vagus nerve. So there's this kind of like branch that sits over parts of the ear that you can get vagus nerve stimulation by stimulating that part. So kind of like, again, non-invasive way to do it. And it's vibration. Most vibration feels pretty good. It's non-nauseating. It's not noxious. So using that can be a good tool. So what they found was, this is a cool little paper. So the results demonstrate vibrotactile stimulation of the cymboconcha attenuates inflammatory responses in both health and disease, and further suggests that the auricular branch of the vagus nerve is a functional component of the inflammatory reflex. Using a crossover study, they found that the vibrotactile stimulation at the cymboconcha, but not at the gastroc, reduces the inflammation, such as TNF, tumor necrosis factor, interleukin-6, and interleukin-1 beta. So what they did was they said, hey, we're stimulating the ear, and they were drawing blood on these patients. And they found that it was reducing some inflammatory markers that may have been causing issues with rheumatoid arthritis for these patients. And so then what they did was they said, hey, that works on the ear, like would it work on the gastroc? So they put it on the patient's calf muscle and it didn't have the same effect. So that's a little bit more of a direct linkage to that vagus nerve and vagus nerve stimulation. So I thought that was pretty cool. And this was from a paper from Banzel et al. In 2010. This was the second paper that he wrote regarding the gut-brain axis and traumatic brain injury. The first one showed breakdown, but the second one showed that if they used vagus nerve stimulation, so this is the lining of your gut, okay? So these are tight junctions within the gut lining. And what they found was 6 hours after a traumatic brain injury that had a low vagal tone, if you will, they had breakdown in their gut lining. But if they provided vagus nerve stimulation, so they had better vagal tone, and then the traumatic brain injury was induced, and this is in mice, unfortunately, there was tight junction integrity. So vagus nerve stimulation is important for lots of different things, and it can really help with our barrier systems. And as we know, the healthier our barrier systems, the better off we are, because those barrier systems are there for a specific reason. It's to get the good stuff in and keep the bad stuff out. So there's lots of ways to do this with electrical stimulation. Obviously, talk to your healthcare provider before pursuing any of this. Don't just go on Amazon, buy a TENS unit and do any of this stuff. You got to make sure that it's under the supervision of a medical doctor, because there's some very, very important plumbing in the neck. But this is the ear clip that I was talking about. So there's ear clips that are accessories to TENS units that you can put on different areas of the ear to try to stimulate the vagus nerve. There's different medical devices out there now that you can put electrical stimulation directly on the vagus nerve. Some of our followers, they actually have vagal nerve implants that they can stimulate, which seems to be really helping them as well. But these are just the non-invasive side of things. And this is just your good old-fashioned TENS unit pad that's on the posterior aspect, basically on like the mastoid, which is kind of touching the outskirts of some of those vagal nerve branches. If you don't have that, you can get pretty funky with it. So I said this not to generalize anything or make any crazy claims, but this is a vibrating toothbrush, and a vibrating toothbrush is vibration, and there's some light bristles on top. So my thought process is hey, in that research paper, what if they use just like a Colgate vibrating toothbrush on the same area? Does it matter? I don't know, but that's where my head goes. So using different devices to try to provide stimulation to the area. This is just to say, hey, vibration. As we talked about, using laser therapy can be a simple, non-invasive, very low side effect profile way to stimulate the brain and the brainstem as well. And then I also found too, since if you didn't know, Will Ferrell has a six-pack, I found that vagal stimulation, it also can work from bottom up. So we have to remember that the majority of vagal fibers, 20% of the 20, they say about 20% of the fibers are efferent. So fibers going from brain to body, but the majority of fibers are afferent, meaning body to brain. So my thought process is hey, why don't we, instead of just going directly into the cranial nerve location, like origination of that cranial nerve, can we go bottom up? So I would do different types of therapies. I call them like belly rubs, but basically providing stimulation to the gut, vibration, lasering the gut, and could that work as well? I haven't found tons of research on it, but clinically I've seen it to be pretty effective. So the whole point of this is just to say, hey, brainstem stimulation, it can be pretty important. And there's so much research that's coming out now, and the main focus that I've seen is mostly on vagus nerve and the trigeminal system. But having good brainstem function, it basically allows the brain to do what it's supposed to do on a daily basis. So I like this little thingy here. So basically, okay, hey, I'm not getting enough tactile, auditory, and visual stimulation. Will you take over for me, cortex? So that's the brainstem talking to the brain, and the brain's like, all right, cool, but I can't occupy myself with higher thinking if I'm busy doing your job of automatic functions such as eye movements, visual perception, and auditory processing. So basically it's to say, hey, if we have good function of our brainstem, then those higher areas of the brain can kind of do what they're supposed to do, which are a little bit, other important functions that shouldn't be as automatic as down here. So healthy brainstem activity allows for healthy cortex activity. There's several important brainstem centers that allow for better brain function, and there's several roles the brainstem plays with healthy immune activation. So yeah, that's pretty much it. This is just a little intro into our brainstem basics course from the Brain Rehab Basics program. So if you're a practitioner and you've got some time on your hands and you'd love to learn more about this, check out our website. It's www.thebrainchat.com. All of our lectures and notes are recorded, and then we just send them to you via a Dropbox link for you to watch at your pleasure or well-being or allowance of your time, because I know everybody's busy regardless. So hope everyone's doing well, and I'll try to jump off here and answer questions. Sorry, I'm not good at answering questions while I'm talking. But anyways, have a great day, stay safe, and I'll talk to everybody soon.